If you're going to spend time in the backcountry, you're going to deal with soft tissue injuries. Getting a wilderness first aid certification, most of the time you're going to do medicine is dealing with cuts and scrapes and blisters and things of that nature. So we're going to spend a little bit of time going over soft tissue injuries. The most important thing about soft tissue injuries is actually understanding how to treat them. Diagnosing them is not that difficult. So we're going to approach this segment backwards. We're going to start with treatment and then talk a little bit about what we're looking for when we see it and how to evaluate it. The first thing to do with a soft tissue injury is stop the bleeding. How do we stop bleeding? Direct pressure. That's really all you ever need to do. Direct pressure. The best thing to do is have the patient hold pressure on the wound. That leaves you to do other things. Direct pressure is going to stop pretty much all the bleeding you're ever going to encounter. Now, bleeding can look bad, but just because it looks bad doesn't mean it is bad. I bet you all have seen wounds, specifically a wound on someone's scalp that was bleeding and it looked like a horror movie. And then you wiped the blood away and it was a very small cut. Don't get hung up on what it looks like initially. Simply stop the bleeding. Put direct pressure on that wound. Wounds want to stop bleeding. Your body will start clotting in about 2 to 3 minutes. And with direct pressure, you're probably going to stop it all. You might get wounds that continue to bleed even with direct pressure. Well, sometimes we put on what's called a pressure dressing. It's not really a fancy dressing. It simply is a dressing that's held on by something else so you can go do other things. You can hold that on with an ACE wrap or with a gauze pad or a gauze dressing. That will keep pressure on this wound. But direct pressure is going to stop this bleeding. If the pad that you have on there becomes soaked with blood, the bleeding comes through, take it off. Put a new one on. The idea of leaving the pad on and putting other ones on top is wrong. If the dressing is soaked with blood, remove it. You're not going to remove the scab that's starting to form or the clot that's starting to form. If it's still bleeding, there's no clotting. Take it off, put a fresh one on. Now, there is one other type of bleeding that you might encounter, and that is bleeding that will not stop with direct pressure, or you recognize as life-threatening bleeding. Life-threatening bleeding, as I mentioned earlier, is bleeding that you will recognize as life-threatening. It will be bright red blood that is gushing or pumping out of the wound. This is a true life-threatening emergency. How do you stop that? A tourniquet. Before you get worried about putting a tourniquet on, don't be. Tourniquets are great devices. Tourniquets save lives. Even if you still have a fear about tourniquets, or you're worried that if you put a tourniquet on this patient's arm, they might lose their arm, think about the alternative. They have life-threatening bleeding. If you don't put the tourniquet on, they will lose their life. But you don't even have to worry about them losing a limb. Tourniquets can stay on for a very long time. In fact, tourniquets have been proven time and time again to decrease morbidity and mortality of patients, meaning it decreases complications with the wound, and it decreases their chance of dying. If you see life-threatening bleeding, put a tourniquet on, leave it on, get them to definitive care. But you're probably never going to have to deal with that. So direct pressure is all you need. Now the bleeding stopped. What am I going to do next? This is the most important step for wound care. Clean the wound. This is one of the things that defines the practice of medicine in the wilderness versus the practice of medicine in an urban environment, say in an ambulance. If I pick you up in an ambulance and you have a wound, we just stop the bleeding, wrap it up, take you to the hospital. We allow them to take care of the cleaning. In the backcountry, your ability to clean the wound and clean it thoroughly directly affects whether you need to evacuate this patient or you can keep your trip going, whether this wound becomes infected or it heals perfectly fine. You have got to clean the wound. Now, what do you clean the wound with? There are lots of things out there that people think they can clean wounds with, and you have them at home in your medicine cabinet. You're going to throw all of them out. You only clean wounds with water. That is it. In the backcountry, if you can drink the water, you can clean a wound with it. That's all you have to do. You don't need to add anything to it. You don't need soap. You don't need iodine. Simple water. But here's the key. You need a syringe. This needs to be in your first aid kit. You need to have a syringe. This syringe allows me to get pressure into the wound. A nice big syringe like this. I can pull up water, put this tip in, and irrigate this wound. How much water? A lot. People sometimes say, well, what if I'm in the desert and I only have 1 liter of water? You do what you got to do. But you need to clean this wound. You've got to clean it with a lot of water and a lot of pressure. If you don't clean these wounds thoroughly, they will become infected. You will then have to evacuate them. Clean the wounds with water. Why don't we clean with hydrogen peroxide or iodine or alcohol, all the stuff that's in your medicine cabinet? Well, they're never designed for cleaning wounds. You're never going to find a medical provider on an ambulance, in an emergency department, in a hospital, who ever cleans wounds with anything but water. All of those other substances are cellular toxic, meaning, yeah, they'll kill the bad stuff, but they're going to also kill all the healthy tissue that surrounds it. What that does is it retards the healing process. It actually stops the body from healing. It prolongs the wound exposure and makes it actually more prone to infection. Do not clean wounds with anything but water. Cleaning wounds with any of those substances, hydrogen peroxide, iodine, alcohol, is it retards the healing process. Again, it will kill all the bad bacteria and viruses, but it also kills the healthy living tissue. What that means is that your wound is going to stay open longer. It's going to be more prone to infection. You're doing the opposite of what you're trying to accomplish. Only clean wounds with water. Now I've got my wound clean. What do I do now? You're going to dress and bandage it. What's the difference between a dressing and a bandage? Well, a dressing goes on a wound. A bandage holds a dressing in place. How you may have a first aid kit at home and it's got some dressing and bandages in it. But you want to have a good first aid kit with lots of dressing and lots of bandages. You need to have a lot of them. You're going to be using this type of material on most of the medical problems you see out there. Most people will have small 2x2, 2-inch by 2-inch dressings. That's not going to do it. You want a 4-inch dressing at minimum. And when it comes to bandages, 6-inch roller gauze. You really want to make sure that you have roller gauze that can wrap this whole thing up. Just like splinting, this is about functionality, not about form, not about looking pretty. It's about making it work. Other things that you can use, though, are products like Tegaderm, this Tegaderm film. This is a really wonderful product. It's breathable, but waterproof. It's great for outdoor applications because it allows your wound to breathe. It allows light in. Air and light are the enemy of infection, but it keeps it waterproof. It keeps it protected from the environment. A wonderful product, but you have to know how to use it correctly. If you're thinking about Band-Aids, big Band-Aids, not small little 1-inch Band-Aids, big 2-inch Band-Aids at a minimum. If you're going to have a wound that needs taken care of, you want to make sure you take care of it. Once I have this thing dressed and bandaged, what am I going to do now? Well, now it's about monitoring. It's about long-term care. I've got to stay on top of this. What am I monitoring for? Well, we're going to monitor for a couple of things. First off, we need to make sure that we're changing our dressing and bandages. We're changing it at least 2 times a day, in the morning, in the evening, or any time it becomes wet or dirty or nasty or blood-soaked. Don't do what we all do when we get a cut at home, where you put your Band-Aid on and then 4 days later you're in the shower and you remember the Band-Aid's there and you peel it off and the skin underneath is all wrinkled and mottled looking. Change the dressings and bandages. If you're in the backcountry, keeping your wound clean, changing your dressing and bandages frequently is going to allow you to keep your trip going versus having to evacuate. Next thing you're going to do is watch for signs of infection. We have 2 types of infection that we're looking for. The first one is a local infection. What are signs of a local infection? Well, the area around the wound becomes red and hot. You get an increase in pain. You get an increase in swelling. You get pus production. All of those things are a sign that your wound has become infected, but at least it's a local infection. What does that mean? Well, it means I need to get rid of that infection. If your wound has closed up, if it's sealed over, I might need to open this back up. This is when you can use that alcohol wipe you've been carrying around, or the hand sanitizer you have. You can take your knife, sanitize the blade, and simply open up that wound. It might bleed a little bit. That's fine. Encourage it. Push out the pus that's inside. Get it to just bleed. Clean it again. Redress it, rebandage it. And then really stay on top of it. They've got a local infection. It means that they're either more prone to infections, you haven't been changing the dressings and bandages as frequently as you should, or something else is going on. So keep monitoring it. The next one is systemic infection. This wound has become infected, you didn't pay attention to it, and now the infection is spreading to the body. This is going to be an evacuation. This person needs antibiotics at a hospital. How do I know that this wound has become a systemic infection? You're looking for two things. You can have either or you can have both. These two things are red streaks emanating from the wound moving towards the body. So if I have a wound on my arm and I start to see red streaks moving up the arm towards the body, you know that this is becoming a systemic infection. The other one, fever. Fever is the sign of systemic infection. If you have fever secondary to a wound, you know you have an infection, you need to evacuate. Wound care is fairly straightforward and fairly simple, but you need to clean these wounds and you need to stay on top of them. Now, there are some instances where even if the wound is not infected, you really want to think about getting them out. One of the things you need to do is evaluate these wounds. This is a wound. There are lots of different types of wounds: punctures, impalements, avulsions, lacerations. It doesn't really matter what they are. What matters is how you evaluate them. I have a wound here. I want to look at the depth of the wound, the width of the wound, and the length of the wound. All of those things are going to help me decide whether I need further care. The bigger the wound, the deeper the wound, the more definitive care this patient's going to need. I also want to think about, is it in an area that is going to cause lifelong problems if it doesn't get taken care of? Those areas are wounds on joints. If I have wounds over joints, I'm a little more cautious about them. I might think about moving out, maybe shortening my trip, maybe ending the hike for the day. If I have wounds that expose bone, muscle, or tendon, all of those require hospital care. You need to think about getting out. There are two other things that you want to think about. The things I haven't mentioned that you want to do to a wound, and that's because we don't do them to wounds. One of them is using some sort of antibiotic cream, bacitracin. Now, you might know it by another name, but bacitracin is the drug that we're thinking about. These antibiotic creams, you'll see them everywhere, and they're sold in a way that says you can put them on all wounds, and they will prevent infection, and they will prevent scarring. Here's the problem. You have to know what type of soft tissue injury they're meant to be put on. Any type of antibiotic cream, bacitracin, is only meant for abrasions or surface area injuries. That's it. And you, in fact, don't even need it for that. The only reason you're either given it or you buy it is because you don't keep your wound clean. If you simply wash the wound on a regular basis and change the dressing and bandages, you don't need anything else. The problem with bacitracin or antibiotic creams when you're not sure how to use it is people put them in deep cuts, thinking they're going to prevent infection. In fact, what you've done is created a dark, warm, moist pocket that allows bacteria to grow. You're actually going to do the opposite of what you're trying to accomplish. The other thing is wound closure. Closing of wounds is a good thing if you know how and when to do it. Wounds should not be sealed shut unless it's done properly. If I have a wound and it's a cut and it looks like this, and I take it and close it over, inside I've now created a dark, warm, moist pocket. All that's going to happen is an infection's going to brew. In the hospital, if you've ever had a big wound and they gave you stitches, what they did was they closed it layer by layer. Now I have no pocket. The problem is we don't have the stitches in the backcountry. So sometimes you might find those butterfly closure strips or wound closure strips, and people think, hey, having the skin intact is the best way to go. And they take those strips and they seal the wound together. The problem is you're creating that area for bacteria to grow. They're not bad, but again, you need to know how to use them. If you have a big gaping wound, you can take those wound closure strips and bring them close. Bring the edges of the skin close together, but leave it open for air and light to circulate. If you do that, you're going to help prevent infection. One last thing on wound closure. Any type of animal bite, never, ever, ever close. Those are extremely prone to infection. Clean them thoroughly. Bites, which are a type of puncture, are the most prone to infection. When you add in an animal and all the bacteria that it carries in its mouth, you will get an infection if you close those wounds. Clean them thoroughly, dress and bandage them, and evacuate to seek further care. Wound care is what you're going to spend your time doing in the backcountry. So make sure you understand it, make sure you know how to evaluate it and treat it properly.